Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is Alan Edwards. I'm the Medical Director for Orange County Behavioral Health Services, and I have been since June of 2002. Before joining the county, I was active in community behavioral health. I consulted to a number of community clinics. I had a private practice in Westwood near UCLA. I was on the clinical faculty at UCLA for about 7 years, teaching medical students. And for over 30 years, I've done emergency psychiatry. It's the treatment of folks with mental illness, disturbances that are caused by biological or psychological or developmental issues that impairs their ability to enjoy their lives and their role in the community because of disturbances in feelings or thinking or behaviors. Sometimes there's a chemical component to them. The biological components for it are often treated with medications, which is why, as a physician, that's the part of the medical treatment that I provide. Well, I started off in the sciences, and I started off with physics, and then I kind of gravitated towards chemistry, and then I added biochemistry, and I thought while I was at it, I'd add biology, and looking at the prospects of becoming an MD, PhD candidate at Case Western or at UCLA. At some point along the way, I decided I actually ought to go to work. So I enjoyed the clinical interactions of medicine, and I enjoyed psychiatry in part because I liked the interface of the brain and the mind. Additionally, we've learned lots more about adding spirituality and things like that to it, but those are the things that attracted me to begin with. The opportunity to be a part of a team and part of a community that provides services for people who have been historically underserved and for whom hopefulness and recovery haven't been terms that were as readily used and as general expectations. The most inspiring part of the time I spend at work and elsewhere is really the people and their families who live with serious and persistent mental illnesses, and the courage they display in supporting one another and working towards recovery, and really sharing in decisions that can affect their lives in increasingly positive ways. What is surprising about the field in which we work, mental health, behavioral health, is that it's far more pervasive than people think. People don't take the time to reflect and understand that all of us are either a consumer, a family member, a friend, or a colleague of someone living with behavioral health issues and living with either mental illness or challenges or substance use issues, and that it affects everybody in our community, from the president's family, I'm sure, to people at the Civic Center. It's part of everybody's lives. That being said, it's also very exciting to see that the opportunity for recovery is much greater than people imagined, and that the opportunity to leverage our efforts and the efforts that our clients and their families make towards general health care is just gigantic. The improved treatments of infectious disease, of diabetes, of heart disease, as we help people towards recovery, their health literacy and their overall health improves, and our resources that have been diverted towards acute interventions become more supportive and preventative, and that's really good news for the whole healthcare community.